Yeah, we're going to start calling this Women's Wednesday.
That's right.
Because it's Wednesday, and this is our very first Women's Wednesday on Talk of Alabama. And we search Central Alabama for the best of the best when it comes to tackling issues that are important to women and their families.
And guess what? We're very happy to have Dr. Daniel Russo with Russo's Facial Plastic Surgery Clinic and Aesthetic Medical Spa. I had the pleasure of visiting his clinic in Mountain Brook, and all I have to say is I really learned a lot about true beauty. Take a look.
All right, Nicole, this is our clinic that we've been in this facility since 2000. We built this out. Prior to this, I was in a group practice for about 23 years.
Dr. Daniel Russo is one of the top facial plastic surgeons in the country, and he's right here in Birmingham.
This is the first room that patients will come to when they come to our office. This is the consultation room where we first meet, and we'll sit and talk to patients about, what they're concerned about. We'll examine the patient in front of the mirror. We'll talk to them, show them other pictures of patients that we've done similar procedures on.
And patients can see the final result, so to speak, when they walk into this photo imaging room.
This is a great tool for us to communicate with patients. We can change them electronically on the computer and have a meeting of the mind so that the patients, if they're happy with the results that they see, and I feel like we're comfortable that we can achieve those results, then we have a much better chance of getting the patients happy after surgery.
I've never had plastic surgery, but to test this out, I had them take a few snapshots of me.
We literally measure out how wide the eye is, and we then measure the distance between the two eyes should be about the same distance, and the width of the nose should be almost about that same. So if you drop a line from the inner corner down, then the width of the nostril should just about be there, and you're just about there. So those things make you a pretty lady because you have those proportions intact. The distance from the bottom of the chin to the bottom of the nose is about the same as from the bottom of the nose to the brow, and then the bottom, and from the brow up to the hairline. Those things make you look aesthetically pleasing.
On to the state-of-the-art operating rooms.
Well, that's exactly one of the nice things about this, is that it is a very private, very confidential kind of a facility, so patients feel like they don't have to be seen by everybody if they don't want to be.
And not only can you recover in the posh recovery room, the facility is equipped with a spa that includes a facial room, a hair replacement, and hair removal suite.
This whole operating room facility is certified by the what's called AAAHC. AAAHC is one of the largest outpatient surgery certifying organizations. They certify very large outpatient surgery centers, and it's very, very difficult to meet their standards, and we've had that since we first opened up here in 2000, so we're very, very proud of that.
And what an amazing facility that was. And we are joined now live by Dr. Daniel Russo, President of the American Academy of Facial Plastic Surgeons. Thanks for being with us.
Well, thank you for having me. Thank you.
Beautiful facility.
Oh, well, we're very proud of it, really. We work very hard to design it and make it very comfortable for patients when they come to our office.
Tell us, you've been doing this a long time. How did you begin? I mean, what made you want to be a plastic surgeon?
Well, I've always enjoyed people, number one, and I like working with my hands. And when I got into medical school, I saw a rhinoplasty operation, the nasal surgery operation, and I just thought it was one of the neatest things I'd ever seen, how they could do all that without making any external incisions, and it was just a fascinating field to me. I love faces and art. I have an influence of art in my family. My father was an artist, my sisters are both artists, and so this was a way for me to express myself, I think, in many ways artistically.
Doctor, how do you know if somebody's a good candidate for plastic surgery? What are some of the things that make you say, okay, yes, this is somebody that I want to work with?
Well, of course, I think it's important that patients have a good concept of what they're trying to accomplish, and they should have realistic expectations when they come to see us about the things that they're trying to change.
Yes.
And if they have, good sound reasons for wanting to have those changes, and they're things that I think that we can realistically accomplish for them and do it safely, then there's really no reason why we can't achieve the kind of results that we're looking for.
So you have this period where you talk to them and you sort of get to know them a little bit, and there's some discussion about it.
Absolutely.
Yeah.
We have a consultation. We take photographs of the patients. We put them on the computer. We do computer imaging. We talk to the patients about what they would like to achieve, and then we show them pictures of what we think we can achieve for them.
Now, during your career, what's been one of those moments where you said, you know what, today was a good day? You've had many of those moments, but what's one of your most memorable?
Boy, that's a hard question. We were very fortunate to be able to do 2 extreme makeover Birminghams here in the Birmingham area many years ago, and those were dramatic transformations for those patients, which really were very, very gratifying for me. But one of the probably most gratifying that I can think of was a lady who was in an automobile accident and had pretty extensive trauma to her face, and she had had a number of operations done by some very, very good, competent plastic surgeons, and yet they had gotten to a point where they just said they couldn't help her anymore, and she still had quite a lot of scarring and problems that really kept her from getting out in public, and she really was very, very embarrassed about the way she looked, and we were able to take her from that point and do some more things with scar visions, with some fat transfers, muscle transfers, some of the newer technologies that we have with some of the fillers on the face, and plump up areas, and really get her to a point where she was really, really happy with it.
And that reminds me, you've got critics, everybody out there, you've got critics that say, oh, plastic surgeons only reinforce that stereotype that women aren't beautiful enough. But in your case, you can actually change someone's life to make them feel like they can walk out in public or go on a date.
Oh, absolutely. There are some patients that really just truly won't go out in public because of the way that they feel about their appearance. And with some changes that we can do relatively easily in some cases, you can make dramatic transformation in people's lives.
Some of those successes can be seen on your website as well, right?
Yes, we're very, very excited about the website that we've developed, and we've been working on it for a number of years, but we have a number of things that our patients can go to and see the different operations that we do.
And we're going to toss right now to a full screen graphic, so viewers at home, get your pen and get your paper out. Right now you're going to look at Dr. Russo's email and phone number, because what's great about our segment Ladies Wednesday, Dr. Russo will be joining us in some way or another every single Wednesday on our show, and will answer your questions you've got about your body, your image, whatever you want to ask. He is here for you. So get a pen and paper out. You can see it right there on your screen. Email and phone number. And we're so excited you're taking part in Ladies Wednesday with us.
Well, thank you for having me. We're very, very excited about this.
Thank you.
It's
so
good
are
to
we.
meet you, Dr.
Nice to meet you, too.
Glad to have you, and we'll look forward to the times you'll be here in the future as well.
Sounds great.
We're going to take a quick break. We'll be right back.